Good morning or afternoon, everyone. It's an absolute pleasure to be here with you for this epic conference session on the challenge area of cognitive health and dementia. My name is Julie Robillard, and I lead the Neuroscience Engagement and Smart Tech Lab, or the NEST Lab, at the University of British Columbia, and I'll be chairing the session this morning. I would like to begin by acknowledging that the land on which I'm delivering this session today is the traditional, ancestral, and unceded territory of the Musqueam people, and that the Musqueam people have been learning and living here for centuries. I also invite you to reflect on how you are connected to the space in which you find yourself as an attendee today. The Cognitive Health and Dementia Challenge Area focuses on technology-based solutions that promote cognitive health and active lifestyles to help delay the onset of cognitive decline and provide assistance to those who are already experiencing impairment. This is an important challenge area with a huge opportunity for the development of technologies that empower older adults to be proactive about their health. It's also a challenge area that's close to my own research interests, as in the NEST, with the support of AgeWell, we have been investigating how social robots can support older adults with and without lived experience of dementia. So before we get started with our all-star cast of presenters this morning, I have a few reminders for you. First one, the EPIC conference is running for 10 days. So this is from May 30th to June 10th. So be sure to check out all the other sessions. The challenge area presentations will continue to take place on Crowdcast from 1 to 2:30 p.m. Eastern Time, Monday to Thursday next week, with French partner sessions on June 7 and 9. Tomorrow, don't miss the Making Connections, an epic networking event with Jennifer Pope from PhD to Life. That's followed by an APTA-hosted workshop entitled Bridging the Gap, Engaging in the Policy Space as a Health Researcher. And I also encourage you to check out the AgeWell EPIC conference webpage for additional details and registration information. So in terms of the session flow today and some housekeeping, we will have 3 presentations today, and each will be followed with a 5-minute Q&A. And then we'll conclude or follow that up with a general Q&A and discussion that takes place after all the presentations for a larger discourse and to potentially address areas of impact. All of you are welcome and encouraged to use the Ask a Question box to leave a question. You can do that at any time during the presentations. You can comment on other people's questions. You can upvote questions that have already been submitted if you want to save yourself some typing. So all of that is available to you as you are attending this session. And then finally, the session is being recorded and it will be available for playback, and the link to that will be on the EPIC conference site. So with that, I would like to start by introducing our first presenter for the session, who is Laura Ault. And she's been working as a research coordinator for the Bruyére Research Institute, which is located in Ottawa, for just over 4 years. And with her background in engineering, her projects involve sensing technology to support aging adults and allowing them to continue living in their own homes. And along with her work, she's currently pursuing her master's degree in engineering management through the University of Ottawa. And when she's not working or studying, she enjoys taking the dog for a nice long walk. And so I'm turning things over to you, Laura.
Awesome. Thank you so much, Julie. I'm just going to share my screen now so that you guys can all see my presentation. There we go. All right. Allison, are you able to just confirm that everybody sees this?
Yes, looks great.
Wonderful. Thank you so much. So welcome, everybody, and good afternoon, morning, evening, wherever you are. Today, I'm going to be talking about the Best Buy Assured Living sensor system, as we've just recently finished up a research trial with it. And I'm calling it sort of Sensors as part of the aging journey. First, I'll introduce myself a little bit as to, who am I? So like Julie mentioned, I am a research coordinator for the Bruyére Research Institute located in Ottawa. I have been with the team for just under 5 years now, and I've been working on a lot of projects that involve sensors to support older adults with cognitive impairment, as well as their care partners. So we really like the, aging in place technology, and then looking at ways to support formal care staff as well. I received my Bachelor's of Engineering in Biomedical and Electrical Engineering at Carleton University, and currently I'm in my Master's for Engineering Management at the U of O, so I'm a little bit of a university trader in that sense, but they've forgiven me over at Carleton. Couple project partners. So this project, we've obviously partnered with Best Buy, as they were kind enough to let us use their assured living sensor system. We have also worked closely with Carleton University, Agewell, of course, and Bruyére was on this as well. So what is the Best Buy Assured Living system? In case you have not heard of it, it's a sensor system that you place in your home. It consists of various sensors, such as, a motion sensor, contact sensors, which can go on doorways and windows, a panic button, there's water sensors, there's a variety of sensors that are available for this system, but we only used sort of a small collection, which I will dive into a little bit later. And all these sensors are connected with a nice panel hub that gives you the sensor status. And then the other really great thing is that this sensor system has an AI component which actually learns about sort of your normal behavior. And then it produces a daily report. And so the report will come back, with all green check marks saying everything is good if your previous day looks similar to what your normal has been defined by the system. And if there's something a little bit off, then it sort of gives you, either a red alert or sort of a warning yellow alert saying, something's different. So an alert could be something like you went to bed a little bit later last night than previously. And so that's been really helpful with this sensor system. So part of our research project, we took this assured living system and we installed it into 5 homes within Ottawa. Each home lived with the sensor platform for 3 months. And our participants included 2 homes where we actually had a person living with dementia, and then 3 homes where there were remote care partners. So in one case, it was a couple, and in other cases, it was a single older adult living. And for our people living with dementia, they were early onset dementia. Each home also received 2 of the assured living systems, one which we called the base system and one which was called the expanded system. So what was the difference between these 2 systems? The base system included motion sensors in all rooms to report on room occupancy status, contact sensors on the exit doorways to detect sort of in and out of home, or people coming and going potentially. Of course, we don't have confirmation 100%. A bed sensor, which was used for in and out of bed detection. So, going to bed, waking up, getting up in the middle of the night, those kinds of data points. And then we also included the Well Cam, which is a smart video camera, and that we placed in the kitchen. And I promise I'll dive in a little bit more on that because I'm sure camera and research is raising some red flags. But don't worry, we did have ethics for everything. And then so the expanded system included all of the sensors from that base system, as well as multiple contact sensors placed in and around the kitchen. So we placed them on cupboards, cabinets, anything, where you might be getting, your spices, your pantries, your plates, cutlery, all of these things with the hope of being able to sort of define what kitchen ADLs look like. So that's sort of a little secondary project that we will be looking at. There's a lot of data we just haven't had time to dive into just yet, but we got a lot of data. So I'll talk a little bit about the camera first, just before I get into some feedback. So we put the camera in the kitchen and it records 30-second snippets of video when it detects motion in front of it. And we actually spoke with our participants as we only wanted to gather when they were actively using the kitchen rather than just passing by. So we picked lunchtime and dinner times, and we asked our participants at installation, what is your usual lunchtime? And then we sort of had a 2-hour window, as some people might not eat right at the same time every night. And in that 2-hour window, if there was motion by the camera, it picked up a 30-second clip. And that's what we use to sort of confirm our kitchen ADLs with all of the sensors attached to the kitchen. So, opening the cutlery, does that actually mean that cutlery was grabbed and used, or was the drawer just open? So how did our participants feel about having sensors in the home? Funnily enough, it was noticed that the cognitive cognitively healthy crew completely forgot about the sensors, as we have seen previously in some of our research projects. So, they're placed up on walls. I typically tend to hide them when I do place them in the home, just so that they're not, on a blank canvas of a wall, sort of, staring at you. So a lot of them did say that they forgot, but those of our participants with the early onset dementia were the ones who did notice the sensors and did ask questions. Perhaps it was, they forgot that they were told the answer the day before, but that was really it. There was no real stress around having these sensors in the home. So that was just nice to know and reassuring, as it's always good to see that we can install these sensors and people aren't going to feel as though they are being watched by Big Brother. The thoughts on the camera, we noticed that of the 5 homes, 3 of the homes said that they completely forgot the camera was there. Again, I did kind of try to place it in a way that it sort of blended in with the canvas of the camera of the kitchen. One even said that they took comfort in knowing that the camera was there, so that if something were to happen while they were in the kitchen, it would be caught, and somebody may be alerted, which brought on comfort, which was just really nice to hear. And then the other 2 said that they did notice having the camera there, and they were cautious of it being there during the times that we had said, it's going to be recording between, time A and time B, and it's going to be 30-second clips. And they said that they noticed, and they said that they, were cautious of what they were doing, and but otherwise really didn't mind having it there, knowing that, at 8 a.m. when they come down with their, bed head on, looking for that first sip of coffee, we weren't going to be looking at that. And then, of course, the daily reports. So our participants receive daily reports on their sensor system. And so that's the image that I have just on the side of the screen here. I wanted to find one that did have sort of an unusual event alert, just because, green check mark is super boring. So you can see that this system in particular did report that total sleep time was a little bit below than the night before, and bedtime was below average, meaning I guess it was a little bit later, and then same thing for wake up time. It was likely a little bit earlier, so it just means that overall that was an unusual event, and that's the kind of report that people would be getting daily sent to their email. All of our participants said that this information was useful to have, and they enjoyed sort of getting that feedback on their behaviors. One thing that they would have liked was to see a little bit more information, more specifics on the information, and then things along sleep and activities. So that kind of brings me to another project that I just wanted to quickly touch on with my remaining time. It is an age-well project, and it's in partnership with the Oregon Health and Science University, where we're using the CART sensor platform. I have previously talked about it actually at an EPIC conference. Because I am limited on time, I'm not going to dive in too much on that. But with this sensor platform, we actually ran a couple focus groups to talk about what it would be like to have this sort of feedback application or report sent to people living with a sensor system, specifically those caring for somebody with cognitive impairment. And so our Best Buy project did actually confirm that some of our findings from the focus groups, people do want to have this information. They like to know. They did say that, a daily report was a lot, and they kind of missed a couple days here and there. And that's things that we also noted in some of our focus groups. But they said they wanted that specific information. And so we actually have been working on this web-based application right now to look at, your sleep count for the day compared to a baseline, your sleep, again, compared to that baseline, and then room occupancy, which can be sort of tied potentially to providing care and support for an older loved one. Depending on only, if there's 2 people in the home or more, it gets a little bit challenging after that. But it was all just, it was nice to see that one of our projects was able to confirm and support some of the information. And we're actually sort of able to use the 2 projects and the information that we gathered from our participants to support both, which is, I don't know if there's nothing more age well than that. So I will stop talking now and open the door for questions. And of course, a big thank you to AgeWell and all of the support that we received from our team at Best Buy.
Well, thank you, Laura, for a great overview of this sensing technology and sort of early days of engaging end users around how that works for them. Remember, you can put questions in the Q&A box, and we have some that are coming in. One that was already answered, but I want to just mention for everyone, the slides are not going to be shared for these presentations today, but the recordings are going to be available for you to look at again. So Laura, a couple questions. We have 5 minutes now, but keep in mind that we have a longer discussion at the end for any questions that remain unanswered. So let's start you off. What are the real world applications of these sensors, and how is this data being applied?
So the real world application is, I guess the assured living is used for, providing that assurance to, remote care partners. So if you've got, older parents that you just want to keep an eye on, that is really, I think, the overall sort of main design of the assured living platform. And they're trying to, increase the, people interested in purchasing a system prior to actually requiring a system. So, buying before you absolutely need it, if that makes sense. We used it a lot for, of course, the data coming through, and then looking at those kitchen activities of daily living, because right now that's not something that a lot of people have been able to explore. So that's really cool data that I'm excited to dig into. It's just hasn't been something that we've looked at just yet. But it all kind of branches on to sort of the idea of a security system, and when something changes, send an alert. So there was also a panic button located. So, if, there was a potential fall, something was happening, and there's no time to maybe pick up the phone, if you just press that panic button, a text can be sent to, a predetermined cell phone number. So it typically goes to sort of the child or spouse of the person of concern, I will say.
Great, thank you. We have also another question that's been upvoted. So remember, for our attendees, you can upvote questions that you think should get asked first. One of our attendees is asking, what about data privacy? Where does all the data go? How secure is it? And who uses it?
Great question. Great question. So all of the data is stored through the Best Buy Assured Living team, which is local to Canada. So it's not crossing international borders. I have access to it because of the research, and anything that we sort of wanted to keep, just because the data does have a recycle period. Anything we wanted to keep, we would download and put on our secured servers, which are housed at Carleton University. And then the only people who have access are the research team. So I assume this question was probably prompted with the video, because, who wants to know that their videos are being broadcasted. So with respect to the video especially, I would download the video clips from the Best Buy sort of page, the Assured Living page, and then put them up on our secured server held at Carleton. And then the only people who have access to the folders of those video clips are the people on the research team who will be analyzing the data.
Great, yeah, thank you. This is a very important question. We also have a question around the daily reports, and I actually had the same question, so I'm glad it's being brought up. So one of our attendees is asking, do you have a sense of why the daily reports give people comfort? And this is a participant who's not 100% clear on the value of these reports.
Totally understand, but I think a lot of it comes from knowing that things are either consistent or not. So a lot of our participants, especially those who were in the more care partner role, were concerned about their loved one. Did they get enough sleep last night? Are they getting enough activity during the day? Are they moving around the house enough? Because it's enough to monitor your own sort of daily health, but as soon as you have to make sure that somebody else is getting their 8 hours of sleep, and how often do they get up at night, that does take away from your own sleep quality and everything. So they found comfort knowing that, okay, I'm getting my X number of hours of sleep, and so is my partner or the person that I'm caring about. So in the case that if you had sort of your parent living with you and your family, and let's say you did put this system just sort of in their room and you wanted to know if they're sleeping or how often they're getting up at night. If that doesn't change, that is always a good sign. But if it does change and you do start to get sort of those constant red alerts that, there's more bed exits than usual, bedtime is getting later or wake up time is getting earlier, something could be changing. And that can always be, used as information to provide to your physician at that next appointment, prior to an adverse event, I'll say. So that's where a lot of people did take comfort. I would say most of the comfort actually comes from the fact that, no news is good news. And so if things aren't changing, everything is working well and think people are, living normally.
Okay, thank you. I think I have time for one or two more questions. Another one that's been upvoted in the Q&A box starts with some praise. Great presentation. This participant says, I can see how beneficial this software would be from a therapeutic perspective and facilitating discharge from hospital to home, particularly in areas where home care provision might be sparse. So the question is whether this device can be personalized to have prompts and reminders and potentially other links to IoT.
There is some personalization, but I don't believe we can do the prompts unless an action is triggered. So in the sense of, I'll say, the lack of an action, it can't provide a prompt. So, if you place this contact sensor on a fridge, if the fridge opens and you want some form of an alert to come through to say, close the fridge, that's doable. If, however, the fridge doesn't open before 10 a.m., you can't send that prompt to say, remember to eat your cereal and get your milk or something like that. So that's, and that's, smart technology kind of in a nutshell right there. That's one of the bigger struggles right now is a lot of smart technology is able to sort of have that call and response. It's the lack of call and response that we're working on, I guess. Hopefully somebody smarter than I is working on this.
As smart as you, Laura. And one more for you before we move on to our next presenter. Another one that's been upvoted. Did your study look into analyzing fall risk? And did any participants suffer from falls while engaged in your work?
During the study, there were no falls. We did not recruit people who were high falls risks just because of the nature of the study. We actually wanted sort of very mobile older adults. In terms of falls, that's not really something that we looked at with this study. I'm sure there are things that could be programmed in terms of the out of bed, especially if it's sort of a night falls that's of concern. But falls in general are just a very complex topic, and it's so hard to sense without, I will say, like physical wearables and everything like that. But yeah, it's something that comes up in a lot of my other research projects that we're looking at. So it's definitely a relevant topic to sensors and platforms and everything like that, but not something that this study in specific looked at.
For sure, yeah. Great. Well, with that, Laura will say thank you. And remember, Laura is going to come back to us at the end of the session with all of our presenters for more discussion. So if your question hasn't been answered yet, stay tuned. It may come up later. Thank you, Laura.
Thank you so much.
Okay, our second presenter for this session is Bryan Hong, who is a PhD candidate studying the cognitive neuroscience of memory with Dr. Morgan Burns at the University of Toronto. And broadly, he's interested in studying how context is used to organize memory retrieval. In addition to his research, he is also co-founder of Dynamic Memory Solutions, where he has been working on the development, validation, and commercialization of Hippocamera, which is a smartphone app that leverages principles from cognitive neuroscience to help mitigate memory loss for events from our day-to-day lives. And so over to you, Bryan, for your presentation.
Hey, everyone. Thanks for the lovely intro. And I'm excited to be here and hope everyone's doing well. I'm really excited to tell you a little bit today about this project that I've been working on called Hippocamera, which is a neuroscience-guided smartphone app to help improve memory for everyday events. To start off with, I want to first describe the problem that we're trying to solve with Hippocamera. Memory loss is one of the most debilitating outcomes of dementia, and it can happen quite early during the course of the disease, and even during the normal aging process. So let's just have an example. Let's say that you're going out to grab a coffee with a group of friends. During that event, there are a lot of details that occur. So you might need to remember who you went with, what coffee shop you went to, maybe the conversations that you had and the plans that you made to do in the future. Someone experiencing memory loss is likely to only remember the vaguest of details, if anything at all. So they might remember that they went to the coffee shop and went to grab a coffee, but they lose those unique elements that really make that experience different from all of the other times that they might have had a coffee. And the thing is that those unique details are really what make up who we are as individuals. So the loss of those details can really impact one's sense of confidence, leaving them feeling isolated from others in their lives, disconnected from the events that they're experiencing, and even disconnected from their own sense of self-identity. Now, this memory loss is a huge concern for people, with over 1/3 of retired individuals reporting dementia as one of their greatest concerns. Currently, 1 in 10 individuals over the age of 65 are currently living with dementia, and this is costing the US and Canadian healthcare systems a combined $300 billion annually. These numbers are only projected to increase in the next few years, which emphasizes this urgent need for scalable and effective interventions to stave off memory decline for as long as we can before dementia occurs, to both improve the quality of life of those affected and to relieve the burden on the healthcare system. Now, to understand how we can devise a solution to this problem, we wanted to consider how memory is affected during the aging and dementia process. So specifically, we have this seahorse-shaped brain structure called the hippocampus. It's about 1 inch deep on either side of your head here, and it's critical for preserving those rich memories for events from your recent past. Unfortunately, what you tend to see is that the hippocampus shrinks with age and dementia, and that rate of loss accelerates after the age of 60. What you also find is that the shrinkage of that hippocampus is also tied to declines in episodic memory, which is responsible for memory of those specific details that we had talked about previously. So with this in mind, we set out to develop a smartphone-based memory aid called Hippocamera that's designed based on how the brain works. So the idea is relatively simple. What we wanted to do was take what we knew about how the hippocampus supports memory and then build a digital reminiscence platform to mimic it. And specifically, we wanted to mimic how the hippocampus supports the acquisition and retention of new memories. So with Hippocamera, it's an easy-to-use and non-invasive tool, and hopefully it can compensate for the hippocampal damage that's associated with the aging and dementia process. And it helps to allow users to better remember the events of their lives that might otherwise be forgotten. Now with Hippocamera, we designed it to be intentionally simple with 2 key functions. So the idea is that Hippocamera will guide users to both record and then later review these really powerful memory cues. So I just wanted to walk through some of those functions together. So the idea is that if you have an event that you might want to remember later on, you would take out your phone with Hippocamera and then you press the create memory button at the top here. And then what happens is it will prompt you to, it will guide you to create this really rich memory cue for that event. So first, it's going to prompt you to record an 8-second verbal description of that event. And then afterwards, you record this short 24-second video snippet. And lastly, you rate the significance of the event. So although it seems quite simple, there's a lot of intentionality behind the design here that's informed by what we know about memory. So the idea is that users are selectively capturing what they want to remember. So what this means is that as you're going about your day, you're thinking about all those different events and whether they're going to be worth recording. And that intentionality makes people pay more attention to those events of your life. So you're more mindful to the things that are going around to you, and we know that this is beneficial to memory. When you do have an event that you want to remember, you have to stop and then describe what makes that event special. So the idea is that you're creating these multimodal, self-generated, and personally relevant cues that are leveraging your own personal knowledge to make it really distinct. And that distinctive cue is going to make it a better trigger for those specific events that we had talked about. Now, after you've recorded these memory cues, Hippocamera will also help to guide you to review these memories in a way that's informed by how we know to optimize memory. So for starters, we use one of the most early empirical findings from experimental psychology. So when you're studying for a test, for example, we know that learning is going to be best if you distribute it or break it up into many short sessions rather than cramming the night before. So the idea is that users are going to get occasional reminders to review their memory cues throughout the day in these short sessions that we call replay sessions that connect up to 5 different events. So when you get that prompt, what happens is you click that replay memory button at the bottom, and then let's go through what a replay session might look like.
Last day of our holiday, Anders and Freya helped gas up the tinny boat. Now we're heading back for a barbecue and a nap. Anders is using his truck to fish for minnows. Soren is cooling us down with his water gun, looking for friendly critters. It's a gorgeous night for roasting marshmallows. About to go on a sunset cruise. So excited for our week together up here.
All right, so I'll pause that video there just because we have an idea of what it looks like. And I'll just describe some of the properties there. So the idea is that each event is going to be preceded by that timestamp, and that embeds it in your temporal context of your mind. And we know that that's going to be a really powerful memory cue. As you might have noticed, those cues have the video speeded up and the audio was overlaid on top. So here, what we were inspired by was this phenomenon called hippocampal replay. And with hippocampal replay, your hippocampus replays those memories in high speed to the rest of your brain in a process that's thought to underpin memory consolidation. So the idea was hopefully we could use that to kind of stand in for some of the functions of the hippocampus and help scaffold the consolidation of recent memories. Lastly, after your replay session, there's a screen that prompts you to take a moment of reflection. And the idea there is that it's designed to help emphasize those different associations across your different memories to see how they're all kind of interconnected. Now, as a scientist, it's really important that we kind of validate those memory benefits of Hippocamera. So we've done extensive validation through both lab-based studies and pilot studies to demonstrate these. So we find that there's robust and long-lasting memory enhancement with these events that are recorded with Hippocamera relative to those that aren't. And we see that these benefits persist even 3 months after you stop using the app. So the idea isn't that the memories are kind of living on Hippocamera itself, but it's changing the way in which you are forming those memories. Not only did using Hippocamera make memory better, but it also increased the positive feelings associated with those memories. So when we ask the users to describe their memories, they're remembered with more positivity evoked than those that aren't. And lastly, we used neuroimaging and functional MRI specifically to show that the events that are recorded with Hippocamera actually sharpen the brain activity in the hippocampus and supporting regions that are important in memory retrieval. We also did a control study to compare the benefits of Hippocamera relative to just standard smartphone use, and we find that there's a large benefit there, likely because the cues on a regular smartphone are not as rich in encoding with the same intentionality. Now, lastly, I just want to describe some of the ongoing and future work that we're doing. So right now we're working on refining the app and developing more features to improve the user experience. So right now it's been kind of living in the lab mostly, but we're trying to enhance it in that way. So for one, we're always looking for ways to integrate cutting edge memory research to optimize those replay sessions. We're investigating whether we can use Hippocamera and the kind of idea behind it to improve other aspects of cognition affected in aging and dementia, such as navigation of spatial routes. We want to develop and build in metrics to help users better track their progress. And then the idea is that we can better tailor recommendations to get better results. And we want to use Hippocamera to mitigate some of the adverse effects of social isolation on memory as well. So we're looking into building in these sharing functions so you can share your cues with others. Now, the development of these features is going to be done in a project in tandem with the LEAP community formed by CABI at Baycrest. And the LEAP community brings together older adults and caregivers to share their experience and feedback using solutions like Hippocamera to make them better. It makes them more accessible and more readily adopted. So I'm personally really looking forward to this project to get that input to develop these new features. So if you want to learn more about the LEAP, there's a link there to read more about it. To end off, I just wanted to provide some of the really inspiring feedback that we received from some of our participants that hopefully mean that we're getting on something here. They report not only benefits to their memory, but some of those other aspects of living that I mentioned previously, such as their confidence, mindfulness, and motivation. I really think that memories make us who we are, and Hippocamera helps to bring people back to those rich moments in their lives that otherwise might be forgotten. So hopefully with Hippocamera, we can create a meaningful difference by bringing this aspect back. Now, I just want to give a huge shout out to the team behind Hippocamera. It's not just me. It includes my supervisor, Dr. Morgan Berens, Luke Harsley, who's been helping us to get ready for a commercial launch, Chris Martin and Chris Honey for their work in their scientific advising, Melissa Mead, Rachel Newsom, Katarina Saville, Miranda Chang to help scale the project, and Andrew Sia, who helped program the beta version. I also want to give a huge thank you to all the organizations that supported us, especially a big shout out to AgeWell for organizing this amazing conference and their support through the Age-Tech Implementation Response Program to help support the project with LEAP that I described. And thank you all for listening.
For a great presentation. I absolutely feel like going camping right now. I think that was possibly a side effect of your example, but that was very illustrative of what you've been working on. A couple of questions for you in the few minutes that we have. Let's start with this. Who are the ideal candidates for this product? And our participant is asking from the perspective of cognitively impaired individuals as well as their caregivers. Who's the ideal Hippocamera user?
For sure. So one thing that we had in mind with this intervention was that it would hopefully be most effective in a preclinical stage. So a lot of the research that's that we've been kind of looking at suggests that the interventions that target dementia are going to be most effective before you start seeing symptoms of cognitive decline. So it's kind of like more of a preventative measure to help stave off that memory decline as long as you can. So the idea is that it's kind of like exercising. It provides those benefits later on. So we kind of wanted to draw that analogy. It's kind of like you're exercising, like your hippocampus kind of, and creating these cues to help confer those benefits for later on.
Wonderful. Yes. You've frozen, but I'm hoping that by the time I read the question, you'll be back.
Sorry.
So we have two questions that sort of that are interested in linking this data to others. And so one of our attendees is asking, is this data then able to be communicated to other reminiscent therapy providers in the memory space to further use recollection tools or data uploaded, maybe serve as a geotag or even as a fuel for a VR headset, for example?
That's really interesting. We haven't formed those collaborations with other companies in terms of integrating it with other platforms, but we are working to develop, this kind of ties back to the previous question, but working in kind of like senior living facilities to develop programs to provide more support to use Hippocamera in those communities. So one thing that we've been working on is this project called Memory Coach. And one idea that I've been kind of, or analogy that I've been using is it's kind of like a book club for your memories. So the idea is that there's like a group of individuals using Hippocamera. They go out and record different events, and they come back and share those events with others. And one of the things that we know about the benefits of memory is kind of like the ability to share it. So being able to practice it is really one of the cool features of that program.
right? A workout for your brain, for your hippocampus.
Yeah, exactly.
Super. Okay, Bryan, in the interest of time, I will cut you loose here. And thank you for a great presentation and for your answers. And again, a reminder that we will be doing a general Q&A with everyone. So we'll bring you back in just a little bit, Bryan. Thank you.
Thank you.
Okay, for our next presentation, we have two speakers. And so I will introduce them both before turning things over to them. Our first of two is JohnAcharibasam, who is a senior research assistant at the Morningstar Lodge, Community Health and Epidemiology at the University of Saskatchewan. And the Morningstar Lodge is located on Treaty 6 territory of the Cree, Saulteaux, Dakota, Lakota, Nakota, and Métis homeland. His work focuses on community-based health research in advancing Indigenous people's health and well-being in Canada. As an immigrant, John acknowledges the need to build cross-cultural bridges among Aboriginal, immigrant, and refugee communities in Saskatchewan and Canada. And hence his research addresses decolonizing methodologies, education, environmental justice, and anti-racial issues. The second speaker for this presentation is Victor Starr, who resides on the Wapi-Mostosis Reserve in Lebret, Saskatchewan. This is the White Buffalo Calf Reserve. He is a member of the Star Blanket Cree Nation. He holds a diploma in management studies through the Saskatchewan Indian Institute of Technologies. He is the community research coordinator working for the Kihiu-Kawaskasit Health Center on Star Blanket Cree Nation. And he's also the CRA for the Morningstar Lodge, bringing the two together. Victor is an Oskapios, or traditional elders helper, presently, and he's been for a long time. He's also an accomplished singer, a language learner, and in his spare time, he studies the history of his First Nation. He considers himself a jack of all trades and has experience working in the construction field, ranching, casino, cashier, customer service, financial field, land-based teachings, and community cultural liaison, and coaching basketball. He enjoys the outdoors and has a pet rabbit named Zane. And so, Victor and John, over to you.
For giving us this opportunity to share our research. We are very grateful. Our research focuses on introducing new technology to monitor the health data of older adults living with multiple morbidities related to dementia in Indigenous communities. It's a project, an ongoing project that runs in 2023. Well, first of all, I'd like to acknowledge that genuinely our project takes place on Treaty 4 territory and the traditional territory of the Cree, the Dene, Nakota, Lakota, Dakota, the Saulteaux, and the homeland of the Métis Nation. Our presentation takes the following outline. First is we talk about early onset dementia within Indigenous communities, all the way to the conclusions and the broader implications of our findings. So without delay, I'll move straight into the presentation. Early onset dementia within Indigenous communities is a major health concern which has been acknowledged by several scholars, including Jacqueline and Walker 2020. Evidence indicates, however, that positive correlation exists between the risk of dementia and multiple older adults. Therefore, access to health tools and education can support Indigenous older adults living in remote communities to understand the ways nutrition, exercise, multiple morbidities, and self-management of health issues relate to early onset dementia and their capacity to shape health outcomes. Based on that, I'll hand over to Victor to say a little bit about our project with AgeWell and the Star Blanket Cree Nation.
Good morning. Yeah, the AgeWell project, in partnership with Star Blanket Cree Nation and AgeWell, MSL is exploring how technology can be used to help manage and monitor multi-morbidities that increase the risk of EOD. 3 new technologies, including a needle-free blood glucose monitoring kit, a blood pressure monitor, and a smart scale, are being introduced to 30 Indigenous older adults in Star Blanket Cree Nation. Indigenous research methodologies and a community-based participatory research design have been adopted to guide the research, where sharing circles have been employed to collect data. Next slide. The objectives. The main objective of the community-based project is to investigate how health technology and education can support Indigenous older adults' health and well-being, as well as mitigate EOD by using technology to advance knowledge of multi-morbidities connected to dementia in Indigenous communities, determine if the impacts of what we consume changes our attitude about food, introducing, testing, and incorporating 3 new technologies in the Starr Cree Nation, and sharing knowledge on healthy living and healthy living lifestyles. So data analysis, NACPA, nanataw ihuin achimona kiga musa kinikek papis kichi das chigewin hasta chigoina. NACPA is an Indigenous qualitative data analysis approach adapted from the collective consensual data analytic procedure. The approach involves bringing community members, experts, research team members, and community partners together to form a panel to analyze the data. Next slide.
Thank you so much, Victor. These are some of our findings, and I would like to state that we are presenting on 2 of the technologies, the blood glucose monitor and the blood pressure monitors. We've just introduced the smart scales, the 3rd technology. So we are yet to collect data on that, community's knowledge on that. So the presentation here today comes from the co-researchers' experiences using the blood pressure monitor and the blood glucose monitor. So our findings so far indicate that the technologies are supporting Indigenous older adults' overall health and well-being. Furthermore, we find that the technologies have helped to promote healthy lifestyles and reduce some of the risk factors associated with multiple morbidities and how these lead to early onset dementia. The treat we just due to space and time, we have only 3 teams here. So the first team is that we find that the technologies are improving overall health and well-being. Second, the non-invasive nature of the technologies make them more appealing. And third, we have health awareness, the creation of general health awareness among the co-researchers and community. So with our first team, we see that most of the co-researchers acknowledge the value of the technologies and are eagerly adopting the needle-free blood glucose monitors and the blood pressure monitors. I'll hand over to Victor to present on some of our community responses to the questions we asked them during the sharing circles.
As one co-researcher said, it's actually helping immensely. If I compare myself to my mother, I wish we had this when she was alive. It would have helped her a whole lot better. Co-research 13. Another co-researcher stated, yes, I think the glucose monitor is helping me manage my health. I'm not a diabetic, but when we use the monitor, when it's low, we have to have something to eat. And when it's too high, well, we just cut back, so it helps us manage our health. Co-researcher 25. A third co-researcher went on to state, I can check my blood pressure at home now without having to walk all the way to the health agency or pharmacy in Belcaris, which is about 20, 30 kilometers away.
Yeah, so on the non-invasive nature of the technology, we recognize that most of the co-researchers reported that because they didn't have to prick themselves with needles, it made the adoption of the technology more easier. As one of the co-researchers stated, I find it very useful. It is better than having to use a needle and having to dispose of needle sharps and everything else like that. So the inconvenience itself of, besides the physical pain of having to use needles on yourselves to check your blood glucose levels, the inconveniences of finding a place to dispose of the needles is also a problem. So another went on to state how convenient it was, even when you are traveling. You can carry this glucose monitor along, and as she indicated, I think the monitor is much easier to use. It is more helpful when you are on the go, and it is easier to check when you are not feeling well. All you have to do is just scan your readings. I am happy to have this monitor. And the same thing with another co-researcher who indicated, I find it helpful, and I find myself checking my glucose more so now. For one person is because of the lancet, when you have to poke your finger. So referring to the old system of having to poke your finger to check your blood glucose level. So the non-invasive nature of the technology makes it more appealing to our co-researchers, as we find out in this research. Number three, our team number three was health awareness. The general creation of that health awareness now to check blood glucose levels and blood pressure levels. As one co-researcher stated, I got the glucose monitor and it seems to be helpful. It makes me more aware of how high or low it is. So it is here referring to blood pressure levels. And another co-researcher also stated, I think the monitor has certainly made me more aware of my health. I don't do it every day, but I try to walk the dog, getting 10,000 steps a day. So that creation of general awareness about health, promoting other health behaviors to try to check blood glucose and pressure levels. So obviously, but the monitor itself has made me a lot more aware of my health, what I need to eat, eat right, that kind of thing. So it is great. That was co-researcher 19. So besides the technologies themselves, we also incorporate health education. So during workshops, we have workshops with community. Victor is doing a great job. That is, he is our community research assistant leading the project and directing us to do things in a culturally appropriate way. We also organize health education. So the workshops, we've had 4 workshops already. In total, we'll have 6 workshops. So we are on workshop 4. On the first workshop, we explore diabetes, and during each workshop, what we do is that we incorporate indigenous teachings and medicines and healing about to promote health. So we have guiding elders who also co-present, and then whilst we present on diabetes, looking at those the Western ways of seeing diabetes, the indigenous elder presents on medicine and how to live right and do things more healthy. So you can see we had troubleshooting. First workshop, we realized some of the co-researchers had problems using the technology, so we incorporated troubleshooting within the second workshop. But on during each workshop, we have indigenous teachings and where an elder co-presents and leads the process. So what does this mean for early onset dementia? The broader implications of our findings. So we focus more on the social and environmental factors because studies as Jacqueline and Walker 2020 show that these are the factors most indigenous communities consider to be the cause of early onset dementia. So by promoting healthy lifestyles and behaviors, the research has the potential to prevent some of the factors that lead to early onset dementia in the Starr Blanket Cree Nation, especially given that our study focuses on younger adults, 55 years. So the age range within which we recruit co-researchers or community members is 55 years and over. So early onset dementia sets in, that is a dementia that occurs before age 65. So having this year group incorporated or involved in the research has the potential to promote healthy lifestyles to prevent some of the multiple morbidities leading to early onset dementia. Again, promoting holistic understanding of staying healthy helps reduce the risk of early onset dementia. When we talk about holistic teachings, we have the elders talking about the spiritual, the mental, the physical, that's the physical, and then dimensions of health. Achieving a balance in all these count, and it is very important within indigenous communities. So we start off our workshops with prayer, and our workshops with prayer, incorporating just having that now we've realized community members is creating a kind of social cohesion within community members during occasions. Those who attend our workshops practically now, as we observe, kind of sit together within other functions and occasions. So bringing community more together, and this has also led to the creation of an elders council. just recently they had so the research has implications beyond even the technology itself. We are realizing just bringing the community together and connection to culture, family, elders, traditional teachings on healthy eating and staying active promotes holistic health, as I indicated, which are more also important for cognitive health. So highlighting the importance of Indigenous healing is very significant. So Indigenous older adults we also realize Indigenous older adults will adopt culturally appropriate technology. Given the history of ethical research, medical trials that have been conducted on Indigenous peoples, the non-invasive nature of the technology was much more appealing. That's the blood glucose monitor. It was much more appealing to co-researchers, as we saw in the responses. Again, family and community play an important role in helping promote healthy lifestyles. So how does that happen? They support the technology use. We hear from co-researchers how younger family members are helping them with the technology. We ask others, so how is the technology working out for you? They say, well, you know what, my grandchild just taught me. Now I can link the blood glucose monitor to my phone. Yeah, it's easy. So we see that family is involved in the whole process as we go on. So support, they also give support to co-researchers. How? Commuting, picking up the glucose monitors from the pharmacy, and at the same time bringing co-researchers to workshops, and so the family and the community grounding research and projects like this on Indigenous family structures and cultures helps a lot. So these are some of the broader outcomes we have realized, and as I indicated, for lack of time and space, these are just a few. There are other teams that are coming up, and as we said, the NACPA process, we just introduced the skills, smart skills, the last technology. So some findings will also come to support the research we are doing well in community. We thank Age Well so much for the continuous support, and these are some of the findings we bring to you today. Thank you so much.
Thank you so much, John and Victor, for a great presentation. I really appreciated that you ended with some broader implications that really helps put the work in context. So thank you for that. We have time for just one question before we move to the panel. So from the Q&A box for the both of you, for John and Victor, what steps did you take to recruit participants in your study, and how did you discuss consent?
Actually, what we did was Morningstar Lodge has continuous long-standing relationships with the Indigenous communities, and Starr Blanket Cree Nation happens to be one of our community partners. So all the research projects we conduct come from the communities themselves. We have a paper published that indicates exploring the health of with Firehill Capel. During that workshop, we organized an overall workshop where community expressed interest in us exploring ways by which older adults could be introduced to technology. Specifically in the recruitment process, what we do is Victor directs the recruitment process, our community research assistant. So we do not approach a co-researcher without permission from Victor. He is leading the recruitment process. So once he gets in touch with the co-researchers, community members who are interested in the research, we get in touch with them, and then we read a consent form to them on every data we collect belongs to the community, which we call knowledge. This data is more abstract. Every knowledge we collect belongs to the community. So we make this point clear. And so the recruitment process and doing things ethically falls within the cultural dimensions, and we read the consent forms to co-researchers and make it clear to them of their ability or power to draw from the study at any time. And so that's how practically we recruit co-researchers.
Thank you. Victor, anything to add?
Yeah, it was pretty easy to recruit because our community is small. I know everyone in the community and everyone over the age of a certain age. So it was pretty easy. It was pretty easy to get 30 because I know the community well and they all know me. So
amazing. This might be the first time ever that I hear that it was easy to recruit. And so congratulations to you for this feat. Wonderful. So in the interest of time, I will thank you for your excellent presentation, but stay with us because we're bringing back all of our presenters for a period of discussion and questions with everyone. I think we can't fit actually everyone on the screen at the same time, but we'll definitely highlight anyone who's speaking as we answer the question. So I want to start by first thanking you again all for your wonderful presentations. And I love this theme that I heard running across all presentations around empowerment and just really empowering older adults to monitor their daily activities and act on that as they see appropriate, to remember and reminisce through the use of novel tools, and to monitor and improve their health through glucose monitoring. So I love this theme. I think it's very, it's a benefit of this challenge area is that we're really looking to empower our end users and working with them to figure out how to do that best. And so I thought that was a really nice thread that came across. There's one question that came up that was upvoted that I think we touched on a little bit after Bryan's presentation, but I'd like to open up to all of you. And this is a question around integration with healthcare professionals and sharing the data with care teams. And specifically, the participant is asking about in-home cognitive assessment tests or aids that measure cognitive health and report it through healthcare professionals through a telehealth model, for example. But I'd like to open up that question and ask you about whether you've thought about integration of the data that you're collecting with medical data or with data that becomes available to healthcare professionals. And I'm going to go in order here. So Laura, we'll start with you. And if you don't have anything to say about this question, there'll be more. So you can just pass the answer over to someone else.
Excellent. Yes, no, I actually think it's hopefully coming very soon that we start sort of taking on these. At least for me, it's more relevant when I say like sensor data and sending it to, the physicians and other, healthcare providers and professionals, because, when you see your doctor, it's that snippet in time. It's that, exact moment, how you're doing right then and there. And so, if you're doing any cognitive tests, it's only, your performance on that specific day, that specific time, versus monitoring over a duration of time. Also, in some cases, with like a lot of times with our care partners, the ones that are in like an informal caring position, it's really hard to ask them, how did you feel a month ago, and how do you feel today? Getting all of that retroactive data is challenging. Whereas if we could sort of somehow provide general data or information, over the course of time, and then catch these little changes, that would also be a little bit easier and hopefully, I would say, valuable for physicians and healthcare professionals. So yes, I hope we get there very soon. I think it's really important, and I'm hoping that at least when I get there, that's where we are.
Yeah, that sounds like a reasonable time frame. But yeah, sooner would be great, actually. Bryan, any comments on integration with healthcare data?
Yeah, for sure. I agree with Laura that it's really important to kind of pick up on these subtle changes that might occur. And by the time that you start seeing like quite noticeable cognitive deficits, it becomes trickier to figure out like how to come up with ways to kind of help improve quality of life at that point. So some of the work in our lab, we've been working on kind of identifying like these preclinical markers, because there are quite subtle ones, like even subtle changes in the way that your eye movements process your environment. I know of like work where I'm drawing a blank on the name of the author, but she developed dementia, and they were actually able to run machine learning models on the books that she wrote throughout the course of her life. So you can start to see the subtle changes in language that she used as she started progressing along in her with her dementia. So trying to figure out these like really subtle markers for when to start bringing up these concerns with your doctor, I think that would be something that'd be really cool to see in the future.
Right. Thank you. John and Victor, any thoughts on that blood glucose data and whether that information gets relayed to a third party?
Victor, can I go? Yes. We do some on routine hospital visits. Some of our co-researchers do share that information with their doctors and other health practitioners. Of course, before they engage in exercise, your sugar level is important. You have to know your sugar level. So we ask and encourage them to discuss with their doctors before they jump into any routine exercise activity in order to be able to maintain their sugar level. So they record their sugar levels, which they share with their health practitioners and doctors, which is good. However, we also have among our teams, our publications, this will be coming up later, where nurses will also ask them, oh, you have to poke yourself. This new technology, you know, I'm not sure. You have to go back to the old method, poke yourself and get your blood glucose level. I think so that kind of also creates a level of like trust issues with the technology too. So if this one new one I'm using is okay, why is the nurse asking me to go back and use the other one? So sometimes when the numbers are not reconciling, there can be an issue, and it depends on what time of the day you take your blood glucose levels. If it is before you eat or after eating, so we try to reconcile some of these things. So sometimes I think these are some of the misunderstandings we see in using their own data they record, giving it to health professionals and this. But overall, the doctors are happy with it, and from the responses we get, and they encourage them to keep on using the technologies. So they do share the data they collect.
Super. Yeah, that makes total sense. Thank you. Victor, anything to add?
No, John hit it
Great,
on the
thank
head
you.
there.
Thank you. Yeah, I mean, through all your responses just now, another thread that I think is really coming across all of your presentations is, you know, providing that information to find that tipping point where end users are thinking, oh, okay, maybe now it's time to check in or to change something or to consult with a healthcare provider. So providing that information, I think could be really potentially impactful. We have questions that came for some of you during your presentations that we didn't have time to get to. So I'm going to ask each of you one, and then we'll go back to questions for everyone. So starting with, let's start with Laura. One question that came up during your presentation was around the step count. And our attendee was wondering, what is the purpose of collecting the step counts, and are these daily step counts?
So I'll clarify just quickly that the Best Buy Assured Living system didn't do any step counts. That's just another sort of that other project with the CART system. That one does do the step counts, and so and then the bridge between the two is that both sort of have that daily sort of feedback, and so the purpose of feedback on the step count is just overall activity. You know, if somebody goes from being very active and getting maybe 5,000-6,000 steps in a day to, you know, sitting on the couch all day and, you know, not wanting to move and maybe only getting 1,000 steps in a day, you know, if that's not really something that's linked to, you know, oh, it's winter now and they're not getting outside for their daily walk, that could be linked to other things and other changes within their cognition. And so that's, you know, a data point that could be brought back to their physician, and all of these little things could add up together to sort of, you know, create this overall image of, you know, how the person is doing, you know. And then on the flip side, you know, for somebody in a caring role, if they typically get maybe 8,000 steps a day, but then suddenly they're being, you know, they're taking on more roles with caring and they're doing a lot more and their steps jump up to maybe 12,000-13,000 in a day, that could mean that they might be at risk at burnout. And so, you know, on the two angles, you know, we're asking, you know, somebody who's in that caring position, you know, how are you doing and how are you feeling? Do you feel you're adding, you know, more care into, you know, your role? They're not going to answer it necessarily truthfully because it's all very subjective, but looking at the data and saying, you know, okay, well, you've gone from, you know, normal step count of 8,000 to all of a sudden 12, you know, what happened? Did you start going for daily walks, or has that all just been from that added load in the care partner role? So on the two flip sides, you can kind of see how it could be relevant information, especially to, you know, a physician or external family members.
Right. Yeah. Thank you, Laura. My next question is for Victor specifically. And so Victor, questions are coming in faster than I can scroll. Where did it go? Oh, here, okay. Oh, it was upvoted, that's why it disappeared. Okay, can you please speak to the value of working with researchers on a project like this and tell us a little bit more about your role as a community research coordinator?
The partnership with MSL and the First Nation Starr Blanket, where I'm from, when I first got the job, I was assigned to recruit co-researchers for a health project. Being new to the health field, but my mother was actually in the health field, so I kind of had a little idea, but I had to recruit these researchers for these new technologies to help them with their multi-morbidities and their blood glucose. So I thought, well, yeah, in my community, diabetes and stuff is high. So I had to record 30. They assigned me to, and I was like, okay. That'd be pretty easy because 30, I know right off the top of my head. Why not 40, 50, 60, maybe everybody, but 30 was pretty easy. And working with MSL, you learn a lot of the health terms, and you get to be introduced to new technologies that I don't even know existed or anybody know existed. Like today, I'm learning lots about that sensor and that app. I already, in my mind, I already know people who would be able to benefit from those apps and other technologies already. So you learn lots, and the partnership grows. You learn from each other. And, being a co-researcher is new for me, but kind of excelled at it because of the outgoing personality and knowing your community, knowing who all is in your community, and them knowing you, they trust you too, they trust me too. So that's how it was easy to get co-researchers. You're like, oh, okay, we'll sign up because you're asking us to. It's like, okay. So it's very beneficial working together, bringing the two health professionals, healthcare workers, labs, all these together with the community. It's very much needed. Thank you.
Wonderful. Thanks, Victor. You make it look so easy. You make it sound so easy. That's wonderful. So one question for Bryan, and then I'll open it up. I'll open a few questions up for all of you. So Bryan, one of our attendees is asking, is it possible that the reminding to remember works essentially to improve your memory? So can you please comment on that?
For sure, yeah. I think that's a really good point, and I think that's one of the, I think initially when we set out to design the app, that's not something that we were really thinking about, but in a lot of like the feedback that we received from the users, we found that might be one of the reasons that might be driving some of the memory benefits that we see. So specifically this idea that you're paying attention to kind of like the things that are going about around you and taking note and saying, hey, this is a moment that I want to remember later on. This moment is special for me. And just having that moment of just like stopping and reflecting and saying, hey, this is important to me, is going to be important in boosting recall for that event later on. So we definitely think that is one way that Hippocamera is benefiting memory.
Wonderful. Thank you, Bryan. Okay, I'd like to bring things back to our challenge area around cognitive health. And I'd like to ask all of you about how you feel your technology, whether the sensor system or the Hippocamera or the glucose monitoring technology, how do these technologies really help individuals who may be living with cognitive impairment, whether early onset dementia, or other forms of cognitive impairment, and how you've witnessed that impact really in your populations of interest. And so starting with John and Victor, how do you feel your monitor helps individuals living with early onset dementia?
For our research, I don't think we have anyone involved in the research who is having experiencing early onset dementia. in our case, it's more of trying to prevent early onset dementia, but community members may have experience of family members who are living with early onset dementia. So, and as we have realized, research, Fox et al. 2014 in their paper, they did indicate that people living with dementia also had about 60% of the population they studied also had multiple morbidities. So in case of trying to control some of these multiple morbidities to prevent exacerbating them, hospitalizations that come with cost. So we have cutting down on certain foods to eat and certain foods not to eat. So we see some of the co-researchers have multiple morbidities. This is where we see the impact to really help. So someone who has diabetes, in terms of nutrition, what do you do? In terms of exercise, what do you do? How do you manage your health condition? So this is where we see the technology really helping, and the broader implications where family members who may have early onset dementia, co-researchers who are involved in this research can apply the knowledge they learn here and the technology in helping monitor their behaviors and lifestyles to promote, make things easier to cope with, right, we can say. So
yeah, great. Thank you, John. Bryan, over to you.
Sorry, I was just trying to find the button to unmute. Working with people who, I think I alluded to it a little bit before, but we're working on developing programs to, sorry, let me back up a little bit. A lot of the research that I presented today was done with individuals in kind of like just, I guess, healthy, normal aging. But we've been working on developing a program to work with individuals who are in the progression of dementia with that program that I described before, where you get a group of individuals and there's someone from the senior living facility who helps them use the app and use it in their day-to-day life. And just hearing some of the feedback that we've received from some of them, it really sounds like it is making a difference. They report having this feeling of still wanting to grow and continue making these memories and forming, like, being able to share stories with their loved ones. And some of the feedback that we received is that using the app over the course of using the app, they really allowed them to help share some of those details that they remember with others, and it's been really meaningful to them. And it's really those kind of like nuggets that I really think is that we're onto something with Hippocamera, and hopefully that we can help return those memories to or help to improve memory for those events for individuals.
Right. Yeah, I think just based on the comments in the chat and some of the questions, it does sound like you're onto something with Hippocamera. So that's really nice. Laura, tell us about impact.
Yes. So I think with respect to people living with cognitive impairment, I'll say let's take the example of somebody living alone. With the common saying, especially with cognition, is, use it or lose it, I'll say. So let's say, you've got somebody living alone and their adult children are concerned for their, safety, their health, are they remembering to eat, those kinds of things. And so what they do is they say, okay, well, let's just move mom or dad into our house and we'll do everything for them. But what if we could instead install some kind of a sensor system to just sort of monitor, and then that way when things don't happen, that's when that intervention can take place, picking up the phone and calling and say, make sure you've had your breakfast, make sure you get your milk for your cereal, those kinds of things. Allowing people to remain independent longer will keep them independent longer. And so I think having these sensor systems to just sort of, continue that independence could be very beneficial and impactful. And then, keeps everybody feeling like they're independent, and which is what I would want. So, yeah.
Great. Thank you. Okay, and then I have one final question that we can do also as a roundtable, which is for everyone. And so we'd love to hear about the next steps in your research and the next steps in your work with your community partners. And so let's start with you. Laura. Let's mix it up.
Absolutely. So our next steps for the Best by Assured Living project that we just finished is going to be, tying up that pretty bow on all of the data and really diving into the data that we found. We have a lot of interest around kitchen and kitchen use and how to really sense a kitchen because it's easy to put a motion sensor in a room, but when you're in the kitchen, somebody could be standing in the kitchen, somebody could be opening the fridge, somebody could be making coffee, and all of that in terms of the motion sensor data is going to look the same. So that's sort of our next steps right now, is just to really dive into that data and see, what can we see, what can we get from sensors, and is it going to paint an accurate enough picture with just sensors that we don't need to, deploy that camera. And so that's sort of our next steps. And then, maybe we'll see about running a phase 2.
Yeah, great. Phase 2 trial, I'm guessing you mean.
Yes.
Yes, I would imagine just based on the literature, we do a little bit of work with robots, and of course, to work well, a lot of robots have cameras, and that's definitely something that people are not so keen on. And so if there's a way to make it work without capturing that image data, I think that you're definitely onto something there.
Absolutely.
Okay, John and Victor, next steps in your research and in your work with your community partners.
Victor, can I go? Okay. Yep. The next step, we continue to engage ethically with our community partner. The next step, as I indicated, is introducing the smart scale. So this is the stage where we are. So we have a workshop coming up probably in July to assess how the smart scale is helping our community members live healthily. So this is practically the next step, and we continue with the project and continue to engage ethically with our community partners. So the smart scale is the next thing on our
Victor,
line.
anything to add in terms of your involvement with the community moving forward here?
Yeah, just introducing more technology because they really like this technology. Some of it's not even covered through the government, and some of this is brand new. So, introducing more technology and actually incorporating it into their daily lifestyle schedules. Like, boom, you check your blood glucose monitor; it's high. So rather than going for the pills right away, maybe introducing our traditional medicines too, and incorporating the two world views. I see that happening in the future, and just keep going with it. Keep, especially with our members with multi-morbidities, to prevent dementia and stuff like that, because it seems like when you're diabetic and you're taking these pills, and all of a sudden you have dementia in the future. So preventing before it even happens.
Prevention is a wonderful goal. Yeah, John, did you have anything you wanted to add?
Yes. In fact, some on the importance or significance of the technology to the co-researchers. Some are already asking us, so what happens when the project is done? Are we going to continue to get our sensors? Are we going to continue to get the technology? It's really helping us. So next, we'll look for, in collaboration with community, see how we can carry this project past the deadline of our project with them. So some are already expressing that concern and the need for us to continue with the project. Yeah, last workshop, a co-researcher walked up to me. So what happens when this project is done? Are we going to continue to get our sensors? I said, we'll talk about that one. Yeah, so we see that and the impact the technologies are having on co-researchers' lives. It's wonderful, and thank you so much to AgeWell.
Right. Yeah, that is such an interesting ethical question when we do research with these technologies and then the study is done and we take the technologies home or back to the lab, and if we've uncovered real evidence of benefit, that's a very complex question. How do we handle that? So thank you for raising that. Bryan, next steps for your work.
Yeah, I mentioned a little bit about the project with LEAP that we're working on. So touching on some of the work that John and Victor did, the importance of having co-researchers. So with LEAP, we're hoping to get some input from individuals living with dementia to get feedback on how to make the app more readily accessible and adoptable. So that's one thing that we're working on. We're also working on seeing whether we can use Hippocamera to benefit memory in other diseases that might, or conditions that might affect memory as well. So one thing that we've been looking at is individuals who have depression, which is where memory is implicated as well. So hopefully we can help there. And then also individuals with acquired brain injuries too.
Very interesting. Yeah, it sort of makes sense to branch out to other populations, right? I'm hearing, I think, in response to your work, but in response to John and Victor's presentation specifically, I'm seeing a lot of interest in the comments in the chat around becoming a co-researcher. And I want to thank Allison, who's really the puppet master behind the scenes here. You can't see her, but she's keeping us all going and keeping the session flowing smoothly. And you can see in the chat that she's put some resources to become a member of the AgeWell community. There's a lot of different ways to be involved with research as a participant, but also as a co-researcher or as an advisor. And so I really encourage you to visit that link that was just added to the chat. There's also an opportunity for graduate students and postdoc fellows who may be in attendance. If you're working in the field of digital health solutions, please check out the AgeWell platform Epic AT that was newly launched. So very exciting opportunity there for you. And as I mentioned at the beginning, remember that this is a conference that keeps going until June 10th. And so lots of sessions to look into and register for. And just as we wrap up, I want to really thank all of our speakers, all of our 4 speakers today for their, I think, hope-inspiring presentations. I heard a lot of potential benefits from these technologies for our end users, both as they are deployed, but also in the process of research and development. You know, that engagement can really, I think, benefit everyone at the table. So it's been really wonderful to hear your progress, your next steps, the ways in which you're envisioning the technologies to benefit older adults in the future. So thank you for all your contributions. Thank you for all of you who tuned in and who provided questions. So many questions, we couldn't get to them all, but stay tuned. Perhaps some of the topics will be addressed in other sessions at AgeWell, but really appreciate your engagement and your enthusiasm for the work presented. And thank you to AgeWell for putting together this really wonderful conference with so much to see and hear. So thanks to all of you. Have a great rest of your day.